Our own Dr. John Torres spoke to a group of doctors. You met this group yesterday first, but before we show you part two, let me just remind you of who you're going to be hearing from on the panel. Dr. Anna Lembke, she's the chief of addiction medicine and assistant professor at Stanford University School of Medicine, the author of Drug Dealer MD. Dr. Scott Hadland, he's an addiction specialist at the Grayken Center for Addiction at Boston Med. His research takes aim at the influence of pharmaceutical money on the rate of opioid prescriptions. Dr. Peter Grinspoon is a primary care physician on staff at Mass General. He teaches at Harvard Medical School. He's a former opioid addict who says he's been clean for 10 years. He wrote Free Refills. A doctor confronts his addiction. Dr. Angie Rake is an oral surgeon and an adjunct associate professor at the University of Minnesota School of Dentistry. Her advocacy for opioid addiction treatment was inspired by her brother's history of opioid abuse. And Dr. Thomas Andrew is the former New Hampshire chief medical examiner who retired recently after 20 years. All of these doctors got real. They held nothing back. Let's hear more of their eye-opening conversation.
How did doctors become major enablers in this deadly opioid epidemic? How did we get tricked into thinking that pain was best treated with these addictive medications?
I do think we were betrayed, especially by academic physicians. And as an academic physician, I feel I can say that. You know, folks who are really supposed to be our thought leaders, they were hired guns for Purdue Pharma and others. They went around to doctors and told them, prescribing more opioids is supported by science. You will be practicing evidence-based medicine. And there is a whole generation of doctors, myself included, who absolutely believed this myth. We believed it was based in science. We believed patients couldn't get addicted. We believed it worked for chronic pain. And now we are seeing the results.
There's no one who can convince me otherwise. Yes, we were betrayed, we were misled, and now we have a much bigger problem a decade hence to fix.
You unfortunately see the end result of this as a medical examiner. How many patients that you examined actually died from an overdose because they were taking it for pain?
When I first started in New Hampshire in 1997, we were seeing anywhere from 30 to 40 drug deaths a year. Now in the last 2 or 3 years, we've seen upwards to 500 drug deaths a year. When we started to see that peak, that initial rise, I should say, 2004, 2005, that was clearly driven by prescription opiates leading to habituation and addiction, eventually seeking out some of these opiates illicitly, and ultimately dying of their addiction.
It's becoming increasingly evident that our education and our residency training was infiltrated by the influences of pharmaceuticals, and re-education of ourselves is what's going to solve it.
It's really a case at this point of the path to hell being paved by good intentions. We hear these horror stories about these pill mill doctors that write, obscene amounts of prescriptions.
Right, they're the ones that always get to basically give the rest of us a bad name.
Right, but most of the prescriptions are being written by primary care doctors who are trying to do the right thing.
Dr. Hadland, you did a study where family physicians, I believe it was 1 in 5, actually end up getting payments from pharmaceutical companies.
Most of these are for meals, and yet we know that with every meal that a doctor receives from a pharmaceutical company, they become more likely to prescribe the medication that's being marketed.
The pharmaceutical industries have really brainwashed people, physicians in particular, into prescribing them.
Dr. Rake, your brother was prescribed opioids for cancer.
Correct. Yes.
It didn't turn out so well.
Did not turn out so well. He survived his cancer. In 1999, at the age of 26, he was diagnosed with testicular cancer, had operative procedure done, was prescribed Percocet, oxycodone, and became physically dependent and never recovered from his addiction. He's now living on the streets in Seattle as a heroin addict. Yeah.
What's your take on this? Because we're hearing that, in some instances opioids are appropriate.
Yes.
But we're still prescribing too much, and even those appropriate ones, we need to be very careful. What's your opinion on that?
If I'm going to prescribe an opioid now, it is done very differently than it was 5, 6, 7, 10 years ago. It's done with patient education. I actually have patients, and if they're a minor, I even have them sign it as well, opioid it's like a contract that they have read the potential side effects, the risks. It does tell them that it's addictive, and most importantly, in my opinion, if you have any left over, where to go to the website to dispose of them. Definitely every time I fill out a prescription for an opioid, I have a flash of my brother in my head.
We know these things work, yoga, physical therapy, all these other things. Why aren't we using more of those?
You've got to get the insurance companies to pay for these
Yes,
things.
that's key.
A lot of the time, they won't pay for it. They'll
Right.
say, okay, we've paid for your, two sessions of physical therapy, good luck.
Right.
And you could understand the temptation that a lot of doctors have who might not be as savvy as this panel is of the dangers of opiates, just to write a pill and have the problem go away.
There are primary care doctors who have to see upwards of 40 patients a day at 5 minutes a patient. Really hard to do physical therapy or talk therapy. There are pressures in terms of having patients be satisfied customers. So more and more patients are asked to fill out patient satisfaction surveys, and how doctors are rated can really influence their professional trajectory.
And that's a struggle we, as physicians, we're in the office, that we meet all the time.
I get reimbursed more for a 5-minute medication management visit where I basically just fill out a prescription than I do for an hour of psychotherapy.
So what does that tell everybody?
That tells you a lot about how medicine is practiced today.
Doctors take an oath that says first do no harm. And I think that, as we think about the best way to do good for our patients, I think we used to think that doing good was providing a medication that we perceived would get rid of all of their pain. And now I think we're waking up as a medical community and realizing that sometimes the best thing we can do for our patients is not give them that medication.
What a remarkable discussion.